My patient is Brody. He's a 9-year-old male who is happy, clean. Um, he is alert and oriented times 4. He was able to tell me his birthday, the situation, what we were doing today, and who the president was. Brody's posture is upright and straight. His gait is steady with no use of assisted devices. Brody's skin is uniform in color with no blemishes, no bruising, no pulsations, no palpable masses. His peripheral pulses are equal bilaterally. His capillary refill is less than 2. His nail beds are pink. We started with Brody's face. His face is symmetrical. Cranial nerve number 7, his facial is intact. He was able to smile for me, frown for me, close his eyes, and puff out his cheek for me. And then we moved on to his head. The hair is evenly distributed, fine, clean, no lesions, no mass, no tenderness upon palpation. We checked everything. He was good. So then we came down and his temporal arteries are palpable equally. And then we checked cranial nerve number 5, trigeminal nerve. That his trigeminal nerve is intact. And then he has no jugular vein distension bilaterally. Listen to carotid arteries with the bell. No bruit noted with the carotid arteries. Looked at the patient's eyes. His cranial nerve number 1, the otic, is intact. He was able to read a sonic cut for me and let me know it says sonic. His sclera is clear and white. His conjunctiva is pink and shiny. No drainage coming from the eyes and no complaints of no sight and or no complaints in the pain in the eyes. Then we move to the ears. Cranial nerve number 8. The acoustic is intact. He was able to repeat back what I whispered into his ears while holding his ears. There is no drainage coming from the ears, no redness, no tenderness upon palpations, no masses or lesions on the ears. Then we move to the nose. Cranial nerve number 2, the olfactory, is intact. He was able to smell a donut. Septum is midline, no drainage from the nose. Patient able to breathe with no issues. Then we moved on to the mouth. Cranial nerve number 9, glossopharyngeal, was intact, and cranial nerve number 12, hypoglossal nerve, was intact. Mucous membrane is pink and moist. Lips show no cracking. His lips are pink as well. His tongue was good. Soft palate's good. Tonsils are at a 2+, a little enlarged, and they are reddish. Then we moved on to the neck. No lymph nodes are palpable and no tenderness upon palpating lymph nodes. Frontal sinuses, no tenderness, and maxillary sinuses, no tenderness upon palpation. All lymph nodes are not palpable, as I said. We tested cranial nerve number 11, the accessory nerve. It is intact upon pressure on each side on strength. And then we moved down to the chest. And patient's chest, his respirations are even and unlabored at 18 respirations a minute. Resident's lungs are clear to osculate. No sounds noted. Chest is symmetric. Posterior chest is symmetric. Resident's abdomen, all 4 quadrants are active. Sounds noted in all 4 quadrants. Light palpation and deep palpation with no tenderness noted. We did your lungs. You're back. Kidneys, percussed, No tenderness noted on kidney percussion. Peripheral pulses equal bilaterally. Range of motion strong against resistance in the legs and upper arms bilaterally equally. Apical pulse was palpable at the fifth intercostal left midclavicular line at 75 beats per minute. Heart tones listened on the aortic, the pulmonic, the Erb's point, tricuspid, and the mitral valve with the bell and diaphragm. Range of motion. Patient able to move toes, feet well with no issues. Scoliosis test negative. Spine is in alignment with no issues and no pain upon touching and palpating. And that's it.